Welcome to the Optimized and Unfiltered Podcast, the podcast for men and women in midlife who are ready to optimize their body composition, their energy, and their mindset without guesswork. My name is Amy Kandetzke. I'm a registered nurse and certified hormone specialist, and I help women in midlife get to the root cause of their symptoms so they can balance their hormones, lose the belly fat, and finally have all-day energy again. And on this podcast, we're going to cut through the noise and talk about what actually works in midlife so you can start seeing real results. Most women and men think their metabolism just slows down after 35, but that's not actually what's happening. What's really happening is that your hormones are shifting. And if you don't adjust how you eat, train, and live, your body starts working against you. Again, my name's Amy Kandetzke. I'm a registered nurse and certified hormone specialist, and I help women in midlife get to the root cause of their symptoms so they can balance their hormones, lose the belly fat, and have all day energy. Thanks for being here. Today, we're going to talk about what actually changes hormonally after 35 and why that leads to insulin resistance, higher cortisol, inflammation, and gut issues. And most importantly, what you need to do differently to start seeing results again. So here's what's actually happening after 35. Your body doesn't just age, it shifts. Hormone estrogen and progesterone start to fluctuate. Progesterone often drops first. And progesterone we need for that calming effect on the body because cortisol becomes more dominant and it steals the precursor to progesterone. So now you have less resilience to stress, more blood sugar instability, more fat storage, especially around the belly. This is why women say, I'm doing the same things, but nothing is working anymore. And they're right, because the body they're trying to use those strategies on has changed. So cortisol, the main driver behind everything. Cortisol, this is the hormone that drives everything in midlife. When progesterone drops, your body loses its buffer to stress. So cortisol rises more easily and stays elevated longer. And when cortisol is high, your body holds on to belly fat for dear life. We have 4 times the cortisol receptors in our belly fat than we do anywhere else in our body. And cortisol then increases blood sugar. When your blood sugar becomes unstable, your cravings increase. Your sleep gets disrupted, especially between 2 and 4 a.m., that typical wake up for midlife women. And here's the mistake that I see. Women respond to this by eating less, doing more cardio, skipping meals. But that actually raises cortisol even more. And it keeps your body stuck in fight or flight. Insulin resistance and blood sugar. So now let's talk about insulin, because if insulin is high, fat loss is blocked. And in midlife, due to hormonal shifts, especially declining estrogen and increased cortisol, your body becomes more insulin resistant, meaning your cells don't respond to insulin as well. So when we eat, glucose rises. And insulin comes along and tries to deliver glucose inside the cells. But with insulin resistance, your body has to make more insulin. So think of insulin as Uber drivers. And when glucose can't get inside the cell, your pancreas releases more Uber drivers to do the same job. So now we have increased glucose, increased insulin, and cells that don't respond. So when your cells don't respond well to insulin, your body stores more fat because if insulin can't get glucose inside the cell, glucose then gets stored as fat, especially around your belly. And that happens even if you are eating less. And this is why you can't out cardio or even clean eat your way out of insulin resistance. So no amount of cardio and healthy eating can reverse insulin resistance, can open the doors. It can help, right? There are certain things that can help with insulin resistance, such as strength training, such as eating blood sugar balanced meals. But this is really where you can't just eat the same way that you used to eat. And this is where nutrition has to change. It's not about eating less. You need to eat in a way that stabilizes your blood sugar. So this is protein, fat, and fiber at every single meal. So the amounts that I recommend are 30 grams of protein. Most women in midlife need at least 120 grams of protein. And this is because you need more protein to do the same job. As you get older, you need more protein to do the same job. So you need about 25 grams more of protein to stimulate that muscle protein synthesis. And you need this at every meal. You also need about 10 to even 30 grams of fat per meal. That's 1 to 2 tablespoons of anti-inflammatory fat. This can be avocado, olive oil, avocado oil, nuts, seeds, and fiber. We need fiber. This helps to keep us full. It helps with detoxification. Fat is going to help with satiation, and so is fiber. So this is why a lot of you are eating lower fat diets, and maybe you are hitting your protein goals, but you're hungry an hour and a half later. It's because you didn't have enough fat and fiber at your previous meal. Again, what this looks like is protein at every meal, 30 to 40 grams of protein. And you want to always pair your carbs with protein and fat. So we never want to be eating naked carbs. What does that mean? It means that we don't want to be eating fruit by itself or oatmeal by itself. Some of you are eating oatmeal in the morning with berries. Great, but where's your fat and where's your protein? So we never want to be eating carbs by itself because that is going to cause a very high spike in glucose. We also need to stop skipping meals. When we skip meals, this will actually cause our blood sugar to crash and causes cortisol to spike, our stress hormone. And that over time puts a lot of stress on our adrenal glands, which are already burnt out in midlife. And the other thing that happens is your body starts to break down its own muscle for energy. Our body would much rather break down muscle for energy than fat. And it will do this if we go, let's say, 6 hours without eating. So if you go from 6:30 a.m. to 12:30 p.m., your body's already starting to break down muscle at about the 9:30 mark, 9:30 a.m. So we want balanced meals. We don't want to be restricting. And this is actually how you lower your insulin and unlock fat loss again. All right, now let's talk about inflammation and the gut and how that changes in midlife. So let's go deeper because most women don't realize this piece. When cortisol is high and blood sugar is unstable, you create something called inflammation. Most of you know what inflammation is in the body. And that inflammation directly impacts your gut health. So what it does is it weakens the gut lining, which can cause leaky gut. So we want our gut lining to be like this, but oftentimes with inflammation, our gut looks more like this. It becomes very permeable. So think of your gut lining as like nylons that you pull. And the harder you pull, the weaker that lining gets. Same with inflammation in the gut. So it's going to disrupt the gut lining. It's also going to disrupt your gut microbiome, which is where you have your balance of good and bad bacteria. So now you're dealing with a whole nother problem. You're dealing with bloating, food sensitivities, poor digestion, fatigue, anxiety or depression, and stubborn weight that won't budge. So what I often see, so I do gut testing, so it's called GI map testing. And what I typically see on gut testing is dysbiosis, which is an increase of bad bacteria to good bacteria. Again, this can come from inflammation and stress, not eating enough prebiotic foods, not having diversity in your gut, maybe being on antibiotics that can definitely disrupt your gut lining or your gut microbiome, and it can wipe out your normal gut flora. And when you don't have enough normal gut flora, the bad bacteria can overgrow, causing dysbiosis, bloating, discomfort, and just that distended look in your belly that a lot of us have. I also see H. pylori. H. pylori is so common. It's a bacteria that overgrows given an opportune host. So this can be high stress, low stomach acid, poor digestion. And we can contract H. pylori from food, from other people. Typically, it's from other people. It's very transmissible. And it occurs in most people, like 80% of the population or higher, has H. pylori, but they don't realize it. And even if conventional medicine tests for H. pylori, it's typically only looking for very, very high amounts. Whereas the gut test that I do, it looks to see if it's present at all. So a lot of women are surprised when that H. pylori comes back positive because they say that, I went to my gastroenterologist and they tested me for H. pylori, but it was negative. Well, you actually have it. It's just they were testing for very, very high amounts. So if someone has it and they have bloating, acid reflux is a huge symptom that is from H. pylori that a lot of people don't realize. And if they have it, I treat it. But I don't treat it unless I test for it. So I wouldn't just test you because you had symptoms. I definitely want to test to see if you have it. We don't guess because there's no need in taking unnecessary supplements and wasting your money if you don't have it. However, if you do have it, then it's very likely that your spouse has it, maybe your kids have it also. So I typically treat the whole family. And this will cause low stomach acid, which then holds the doors open for other pathogens and bacteria to basically come in and ferment. And it also decreases your stomach acid. And when we don't have enough stomach acid, it's a problem because when we eat food, we need enough stomach acid to fully break down our food and sterilize it and digest it. And so when we don't have enough stomach acid, then larger particles of food will pass through our gut and sit and ferment, especially if we're not having regular bowel movements daily. And this bacteria just overgrows and again, creates the dysbiosis. There can be parasites that I see, candida, and these are all things that I check for on the GI map test. So here's the problem with the, having poor gut health and leaky gut and dysbiosis. Again, another diet is not going to help this, or going on a specific diet is not going to eradicate these infections. We have to do specific gut protocols. And the thing is, when you have inflammation in the gut, you have inflammation everywhere in your body, unfortunately. So I always test with my clients. I never guess. And testing that I do, again, include the GI map test, the Dutch hormone test, and HTMA testing. HTMA testing is really important because it tests for minerals. Minerals are the spark plugs to your body. So they control your metabolism, blood sugar, digestion, detoxification. If you don't have enough minerals, you actually can't make stomach acid, which then again, like I just said, if you don't have enough stomach acid, then you're having these big particles of food pass through your digestive system and grow and ferment this bacteria. Okay. So when I do the HTMA testing, I look at your mineral imbalances and we're going to look at your first 4 macro minerals, which are the most important. They control your nervous system, detoxification, digestion, insulin response. And these macro minerals are your calcium, magnesium, sodium, and potassium. And so some of you might say, oh, well, I get that lab work checked with my doctor twice a year. Well, minerals, most of the minerals in your body are inside your cell. And the problem with blood work is that it's looking at things outside the cell. So anything in blood work is outside your cell. So your 99% of your minerals live inside your cell. So there can be a lot of imbalances happening inside the cell before it even shows up on blood work. And that's typically what I see. The other thing that I typically see on HTMA testing is a poor adrenal function. So the HTMA testing will show me if you were in stage 1, stage 2, or stage 3 adrenal dysfunction. And this is really important because this causes a lot of fatigue in the body. It causes a sluggish digestion. It causes poor immune health and poor recovery. So I have a lot of women say, this happened 2 years ago and I feel like I never fully recovered. So maybe they had a death of a loved, really stressful job, or maybe they had COVID or a bad relationship and they feel like they've been exhausted ever since. And that is likely due to mineral depletion And what happens with mineral depletion is magnesium gets depleted first. So most people that I test are deficient in magnesium. And from there, it then will cause sodium to rise because our stress hormones like aldosterone increases sodium and it reabsorbs sodium. So that's why I have a lot of women in stage 1 adrenal dysfunction with high cortisol that feel inflamed and puffy despite not changing anything with their diet. It's due to that stress response. And then from there, potassium usually decreases, and potassium is really important for peristalsis in our digestive tract, so moving things along. We're going to have trouble balancing our blood sugar. We're going to have trouble making ATP, making energy, if we don't have enough potassium. And so these minerals are really important. The other mineral that I see it's typically low in midlife women is copper. Copper is, we can't make energy, ATP, without copper and without magnesium. Other minerals I look at are zinc. We need adequate amounts of zinc to make sex hormones like progesterone. Chromium, if we don't have enough chromium, that's going to impact our blood sugar. Other markers are cobalt. So if you have high cobalt, it tells me that you're not methylating B vitamins well. You could have some sluggish liver, poor detoxification, low stomach acid. And then I also look at heavy metals. So we check for heavy metals in the HTMA test. And if you do have heavy metals, then we include a binder called zeolite with your multi-mineral, multivitamin supplement. So based on your HTMA results, I actually customize a multivitamin, multi-mineral supplement for you. And it's just one supplement. It's a powder. And a lot of people like that because they're taking like 10 different supplements and they're like, I don't even know if I need these. I don't even know if I'm wasting my money. I don't know if they're working. And so this is, again, formulated to your body to get you optimized. And I have a lot of women that are saying, well, I already use electrolytes. And that's great. Using electrolytes is better than not using electrolytes, especially for a stressed out body. But electrolytes are made for people that get depleted with exercise. So people that need a little boost. It's not made for people that are severely deficient in minerals. So it's going to, again, this customized formula helps get you back to optimized levels. And a lot of us are so depleted because we've, not only physical stressors, but emotional, mental stressors. Think about how long you've had stress in your body, especially if you're a midlife woman. I know for me, I had a very traumatic childhood growing up and my body was constantly in fight or flight. So by the time I reached my late 20s, I was having a lot of hormone imbalances. I developed PCOS. And by my mid 30s, that's when my sex hormones completely tanked. I started perimenopause at 35. Whereas most people start perimenopause at 45 because of the amount of stress that I had basically my whole life. So it's really important to look at these things, to test these things, because so many of you are struggling with fatigue and poor sleep and, weight gain, brain fog. The other thing I look at with the HTMA test is I look at cellular hypothyroidism. And a lot of women have this. And that's why they can be doing all the things and still have brain fog and low mood and weight gain and hair thinning. This happens a lot. And so they'll say, I have all the symptoms of hypothyroidism, but my doctor checked my thyroid hormones and they are fine. Well, it's because you're making enough thyroid hormones. So yes, your blood work might look fine, but if thyroid hormone isn't able to get inside the cell, then you will experience all the signs and symptoms of hypothyroidism. And this happens in over 90% of the tests that I see, is that women have cellular hypothyroidism. So they have either high calcium, and when you have high calcium, then that binds to iodine receptors and prevents thyroid hormone from doing its job, or they have low potassium. And when you have low potassium, then thyroid hormone can't get inside the cell to do its job. And we need iodine, we need zinc, we need other minerals for thyroid function also. So we do a checklist with the HTMA test to see if you need iodine in addition to balancing your calcium and potassium. And it really helps optimize your thyroid hormone. And then the last test I do is called the Dutch hormone test. And this is a dried urine test. All these tests are actually sent to your home. So it's very easy to collect these samples at the convenience of your own home and then send them back to the lab where I get the results and I go over everything with you on a Zoom call where you can see the results and I can go over everything with you. So the Dutch hormone test is a dried urine test and it tells you what time of the day to take to pee on the strips. It's basically, 7 a.m., 10 a.m., 5 p.m., and 10 p.m. And then you let the strips dry overnight. Super simple. You put them in an envelope and the envelope goes back to the lab. So the Dutch test is great because it's going to look at your estrogen, progesterone, testosterone. And some of you will say, well, my doctor already checked for these. Well, if they checked your blood work, number one, that's a bound hormone. It's not what's actually available to you. And number two, sometimes it's checked at the wrong time in your cycle. So we want to be really strategic in checking these hormones because it has to be done between days 19 and 22 of your cycle, with day 1 being your day 1 of your bleed. So that's going to give us the most accurate results. So I have my women track from day 1. I have them count 19 days, and that's when they can start doing the Dutch test. It's also going to show me your 24-hour cortisol pattern. So, do you start the day really, really low? And is that why you feel like it takes you 2 hours to get going in the morning? That's very, very common. And again, it's due to stress. It's due to not supporting your body the right way in the morning, getting sunlight, minerals, food. Or I typically see cortisol be really, really high in the morning. Again, that can also be due to not eating and supporting your body in the right way, or maybe from not sleeping well the night before. When you sleep, you detox and repair, and when you're not getting that deep restorative sleep, then your cortisol can be higher the next day because you didn't get that rest and repair. And the other thing it's going to show me is your free cortisol, so how much cortisol you're making, but also metabolized cortisol. So are your adrenals keeping up with the daily demands of life? And oftentimes they're not. Oftentimes we are just surviving the day. We're not thriving, we're just surviving. And this test shows me why. And there's a lot that we can do to regulate your cortisol and to get your adrenals working again. A lot of women need some type of desiccated supplement in addition to the mineral support, in addition to maybe some adaptogens. There's an adaptogen blend that I really like, and adaptogens do just that. They adapt to what your body needs. So whether that be, if your cortisol is really low in the morning, adaptogens like licorice can be really helpful because they're stimulating. Whereas ashwagandha is very calming, and you would take that in the evening. So depending on what adaptogen you take, it can adapt to what your body needs. And then it's also going to show me melatonin. So melatonin is our sleepy hormone, and this gets actually produced in the gut and in the brain. So yes, we make melatonin in the pineal gland in our brain, but we also make it in the gut, and a lot of people don't realize that. And so when we have inflammation in the gut, infections, dysbiosis, then that is going to impact our melatonin production. And the other thing that impacts melatonin is serotonin. So if you're not getting sunlight, if you're not eating enough carbs, that is definitely going to directly correlate with melatonin. So I typically tell my women in midlife to eat carbs in the evening, to eat carbs with dinner, especially potatoes, because they increase serotonin, which then gets converted to melatonin, and that can help you sleep. I don't necessarily start women off on melatonin because that can make you feel really groggy the next day. I typically start you with magnesium glycinate, and I recommend starting at about 300 to 400 milligrams of magnesium glycinate at night. That can really help with restorative sleep. It can help relax your muscles, and most women are deficient in magnesium glycinate. And a lot of women tell me that they're taking magnesium. I check their magnesium levels on the HTMA test, and they tell me, hey, I'm taking magnesium. Why is my magnesium low? And I say, well, you're taking it, but it's a blend. It's a complex, and it's not enough for your body. I mean, you can take up to 5 times your body weight in magnesium. So a lot of women are taking 200 milligrams and they need 700 milligrams of magnesium. So I like to use for my clients a topical, I use this for myself too, a topical magnesium, and I'll try and put that in the show notes, what I recommend, as well as an oral magnesium, because when you put the lotion on your skin, it's 10 times more absorbable. So that's why I love using both, because most women in midlife are very depleted in magnesium. The other thing that's going to show me is glutathione. Glutathione is a powerful antioxidant in the body. We need glutathione to detox hormones. So estrogen, progesterone, cortisol. And if we're not detoxing, especially estrogen and cortisol, it gets recycled in the body. And that's going to create belly fat. You know, I don't only look at how much cortisol you're producing, but are you actually detoxing that cortisol? Because if you're not detoxing it, it's just getting stored in your belly fat, because we have 4 times more receptors in our belly for cortisol than we do when we have anywhere else in the body. So with estrogen, there's 3 different pathways of metabolism for estrogen. And that's also what I check with the Dutch test. So the first 2 phases of estrogen detox happen in the liver, and the last phase happens in the gut. So I can see on the gut test if estrogen is getting detoxed properly. And then on the Dutch test, I can see if estrogen is getting detoxed properly through the liver. And typically it's not. Typically it's getting stuck in a pathway and it's not getting detoxed. And then that creates estrogen dominance, which is going to give you PMS symptoms. It's going to give you mood swings, bloating, heavy, painful periods. And that's where you get all of the symptoms, unfortunately. And then I'm going to look at your B6, your B12. We need those hormones, or we need those nutrients to make sex hormones. And it's going to show me your neurotransmitters. So your dopamine, your norepinephrine. We need those neurotransmitters to feel motivated, to have energy, to have drive, to have mental clarity. And if those are low, then there are things that we can do to boost those neurotransmitters. But again, those get made in our gut too. And so if we have inflammation, dysbiosis, we're not making those neurotransmitters. And estrogen also impacts your neurotransmitters. And as we start to lose estrogen, that's why our mood goes a little wonky and we notice more of that low mood, flat. We just kind of feel blah. The things that used to bring us joy no longer bring us joy anymore. And that's typically a sign of low neurotransmitters. So again, there's a lot of things we can do to boost those neurotransmitters, but it's a very comprehensive test that validates a lot of what women are experiencing in midlife, because we look at all the things that their doctor hasn't looked at. So your doctor's not going to look at, you have insulin resistance, because there's no medication to give you. They're not going to look at, do you have leaky gut? Because there's no medication to give you. They're not going to look at, is your testosterone low because you have low libido? Or do you have stage 3 adrenal dysfunction? There's no medication to give you. So if there's no medication to give you, they're not going to check for it. And that is the problem with healthcare today. So that is why I do all these things, because I myself was bedridden 5 years ago. I could barely get out of bed. I could barely take care of myself, never mind my 3 kids. And I was working as a nurse, and I had such severe insulin resistance that my blood sugar would crash and I'd have to stop doing whatever I was doing. I would start profusely sweating. I'd have to lay down, put my feet up. I would basically almost pass out every time my blood sugar dropped. And I had no idea. I was also extremely fatigued. I did have cellular hypothyroidism, which your doctor isn't going to test for that. They're not going to test for cellular hypothyroidism. They're only going to look at your TSH, maybe if you're lucky, your free T3, your free T4. They're not going to look at cellular hypothyroidism. And, I saw many doctors that are like, I don't know what's wrong with you. They diagnosed me with fibromyalgia, Sjogren's, which is an autoimmune condition, and mixed connective tissue disease. But it still didn't explain why I couldn't get out of bed, why I was in severe pain, why I was sick like every week. I would come down with something every single week and I'd be in bed for half the week. Why I was almost passing out every time my blood sugar would drop. Why I would have the most painful, horrific menstrual cycles. Like I would be living on ibuprofen for 2 days. I couldn't even get out of bed. And I would just have a heating pack on my belly for 2 days. And there was a lot of times I couldn't even go to work. It was excruciating. Then I would have cysts burst on my ovaries, and I'd literally I would be doubled over in pain, excruciating pain. I'd go to the emergency room. they would do an ultrasound and they say, it looks like a cyst burst. And this would happen a lot, very often. And I had all these symptoms, and I remember bringing it up to my doctor, I think after my second child, and I'm like, what is happening? I think I have PCOS, because I was Googling it. I was reading about it. And my doctor, he was male, and he looked at me and he said, no, you don't look like you have it. You don't have it. Not one test did not validate any of my symptoms. And I left the doctor's office feeling like I was crazy. And, and just feeling like had been gaslit. And I talked to so many women in the same boat. Like, they go to their doctors and they're like, I have no libido. I'm exhausted all day. I have this belly fat that I can't get rid of. And they're like, yeah, you're just getting older. It's just stress. And they're like, and that's it. Like, that's their solution. Or even women that get their fasting glucose tested and it's in the 90s, and first of all, that's not normal. Having blood sugar, a fasting glucose at 95, that's not normal. And the doctor's like, oh, just watch your diet. Just watch it. It's creeping up. What does that even mean? Watch it. Like, if I didn't know what that meant as a nurse, how does anybody else know what that means? So does that mean cut out carbs? Does that mean do intermittent fasting? Oftentimes those things make it worse. Does that mean eating less? No, because all those things are going to drive cortisol, which is then going to increase blood sugar. No one tells you this. And so the point of telling my story is, I finally had a Dutch test done in 2020, and I realized that I had severe low cortisol. Like, it wasn't even on the graph. The cortisol was so low. And it explained everything. It explained, and I actually had to get checked for Addison's disease, which is an autoimmune condition that basically your body does not make stress hormones. You have to take them orally because your body doesn't make them. And so I did go to the doctor. I explained to my doctor, hey, I want to have this test done. And so they did the test where they basically give me adrenaline to see if my body responds. And my body did respond. So cortisol was elevated. Like, I just made it. I was on the very low end, but it was still in the normal range. So they said I was fine, and they told me to go home. And that was it. And thank God that I worked with a functional practitioner who knew what she was doing. But that's when my health journey began, because I finally had answers that I had been looking for the last 10 years. And so the low cortisol explained my fatigue. It explained my body pain. It explained my sluggish digestion. Like, I looked like I was pregnant by the end of the day. I would wake up with a flat belly, and by the end of the day, I would look like I was 6 months pregnant. No lie. And it also explained why I would almost faint every time my blood sugar would drop, because when your blood sugar drops, your cortisol is supposed to spike to compensate for that blood sugar drop. And I didn't have enough cortisol to combat that. So I would feel all the effects of low blood sugar because I didn't have enough stress hormones to compensate for that blood sugar drop. And it just all made sense. And so after that test, I began to heal. I stopped doing HIIT and lots of cardio because that was burning my adrenals out even more. I started taking supplements to support my adrenals. I started taking adaptogens. I started walking. I integrated some strength training, but I mean, a complete shift in my lifestyle. I really prioritized rest, recovery, and sleep. There was, being part of being a new mom is waking up in the middle of the night with your kids, but that was burning me out even more. So part of healing really included me setting boundaries around what I was able to do and not able to do. And part of that meant my husband was getting up with the kids in the middle of the night because I needed the sleep in order to heal. And then from there, I started doing more tests. I found out that I had mold toxicity, like severe mold toxicity, which was which was causing a lot of my other symptoms, like my poor gut health and my adrenal fatigue. And then I did a gut test, and in that gut test, it showed that I had H. pylori, dysbiosis, leaky gut, candida, severe gluten sensitivity, and lots of inflammation. So I began a protocol to heal my gut. And then I did an HTMA test, which said I was severely depleted. So I was in stage 3 adrenal dysfunction. And, I began a protocol for my adrenals. And I know it can sound very overwhelming. But that's why I'm here, to hold your hand and walk you through all of this, because I didn't have one practitioner to do all these tests. It was like one practitioner, I did a Dutch test, and then I found another practitioner and I did this test. And it just wasn't, those practitioners weren't communicating with each other. And I felt very overwhelmed because one practitioner had me on like 25 supplements, and then the other one had me on another 25 supplements for mold detox. And then I had my gut protocol, which had another slew of supplements, and it was very overwhelming. So that's why, you know, I get these tests for my clients, because it can really validate a lot of symptoms, and it can really start our process in healing the body and getting to the root cause of your symptoms. But I also walk you through exactly how to do these protocols. And I also am very conservative when it comes to supplements, because you don't need 25 supplements. A lot of times you can heal from lifestyle and nutrition alone. And so sure, if your adrenals need support, we can add in one adrenal supplement. But a lot of times you don't need more supplements. You just need to alter your lifestyle, what you're currently doing, your stress levels, and I help walk you through all of that. Another reason for low sex hormones is undereating. Women don't realize, first of all, they don't realize how much they're undereating. And second of all, they don't realize how it's impacting their body. So I met with a woman 2 weeks ago. So it was her onboarding call for my coaching program, my 6-month coaching program. And I always, in the onboarding call, I go through a whole day in the life of that client. And so we talk about what they eat, what time they eat, stress, do they have kids, their work environment, what does that look like? What are they doing for exercise? All the things, right? And so she told me what she was eating in a day, and she really wasn't eating until noon. And so she'd eat at noon, and then she wouldn't eat until 6. And, I understand that people do intermittent fasting and they love it and it works for them, and that's great. Intermittent fasting is fine. But if you're not getting in adequate amount of nutrients, especially protein, in that window, in your feeding window, then it's actually backfiring on your body. It is depleting you further. It's not helping you in any way, especially with women in midlife who are more sensitive to stress. So she was eating 800 calories a day, and she had been doing that for months. Who knows, maybe longer than that. And I can't wait to get back her testing, because I have a feeling that, and she has a lot of symptoms, like she can't sleep through the night. And a lot of that has to do with not being fueled adequately. Your body is basically still in that fight or flight while you're sleeping. So that's a dysregulated nervous system. And if your body doesn't feel safe, it can't adequately get that deep restorative sleep. And so part of my job as a coach is to help women's bodies feel safe again. So they can release fat, but also so they can have all day energy and not crash at 3 p.m. and sleep through the night and not be so irritable and snap at their partner breathing. That is what I help you do. And we do that, and part of my program is through nutrition and helping women eat in a way that's going to fuel their body, fuel their metabolism, fuel their hormones. Because our sex hormones, are built from cholesterol. And a lot of you are not eating enough fat in a day because you think fat is going to make you fat, and it's not. And sure, if you eat excessive amounts of fat, then you're going to increase your overall calorie intake. But I teach you how to eat fat in a way that's not going to make you fat, because we need fat for your hair, skin, nails, sex hormones, libido, adrenal function, thyroid. And it's so important that you don't even realize. And a lot of you are under eating significantly but you're going on TikTok and you're buying the latest supplement on TikTok, and that's not what your body needs. It needs more food, like real food, whole food. And so with my 6-month coaching program, I give you a customized nutrition plan. I give you a customized workout plan. You have an app where you can track everything. I use the app and I love it because it says meal 1, here's what meal 1 is. Meal 2, here's what meal 2 is. Meal 3. And then I track everything. And I also track my workouts and my weights with my workouts. It's really important to do resistance training, which I'll do a whole nother podcast on what types of workouts you should do in midlife to build muscle and balance your hormones. But resistance training is really where it's at. And we need to lift really, really heavy weight to stimulate that muscle growth signal. And we need to lift more weight now than we did in our 20s to stimulate the same signal. So that's why we need more protein, and we need to lift really heavy weight in midlife because we need more in midlife to do the same job. So lifting weights is really, really important. So I give you a customized progressive overload workout program based on what you have access to. So if you go to the gym and you like to work out there, I'll give you one with machines. If you only can work out at home and you have dumbbells, I'll give you a workout with dumbbells. Progressive overload just means that we are stimulating our growth, or we're stimulating growth with our workouts by either increasing the weight or increasing the reps every single week. So if you're curling 20 pounds with bicep curls, then next week maybe you're curling 22 pounds or 25 pounds, right? Or at least you're trying to. Maybe you're doing 10 reps with 20 pounds and you're curling biceps, right? And then the next week, maybe you lift 25 pounds, but you're only doing 8 reps. And then the following week, you're lifting 25 pounds again, but now you're trying to hit 10 reps. And then I recommend that you stick with the same workout for at least 6 weeks because your body needs time to be able to grow. And a lot of you are changing things up every other week because you're bored, but boring is what gets results. And so if you're doing a body pump class, let's say, one day, and then on a Monday, and then the next Monday you're doing a boot camp class, and then the next Monday you're doing CrossFit, and then the next Monday you're doing a strength training workout with machines, your body can never grow. Your muscles can never grow because it's changing way too much, right? So Monday ideally looks the same as every Monday. Wednesday looks the same as every Wednesday. Friday looks the same as every Friday. And you honestly, despite what people say, you only need 3 days of, let's say, a full body workout. So I work with you. I meet my clients where they're at. If they're like, I can only work out 3 days a week, then that's what we do. We do a full body workout. If they can work out 4 or 5 days a week, then we do a split, like upper body and lower body. And then we do functional testing. So I ship all these tests to your door. You get these tests and we look at all your results. We go over everything. And then I give you a customized protocol and plan for each test. And then I coach you every week. We do 45-minute Zoom calls every single week, and we talk about a different topic. So I always have a plan of what I want to talk about, but then the other half of the session is what are your wins from this past week, and what do you see as an obstacle moving forward? What are your goals for this next week? And then we map out a plan for how to achieve those goals. So I hope this is helpful. If your hormones are changing, your strategy needs to change too. So our nutrition, we have to balance our blood sugar, structured eating, protein-focused meals, stop under eating, support your metabolism. Again, exercise, muscle over cardio. This is so huge in midlife. Your goal is no longer just to burn calories. It's to build muscle because the more muscle we have in our body, the more calories that we burn at rest, the more metabolically flexible we are. Metabolic flexibility means we can switch back and forth between burning fat and burning carbs. And we should be able to switch back and forth, but a lot of us are sugar burners and we're not able to switch back and forth. The more muscle we have, the more insulin sensitive we are. We want to be insulin sensitive, not insulin resistant. We talked about progressive overload strength training, ideally 4 times a week, but again, you can achieve muscle building in 3 days a week. And then for cardio, we want to be walking over high intensity cardio. And I know a lot of you guys will roll your eyes like, I don't feel like I got a good workout with walking. Well, walking, we still want to burn calories, and walking is literally the best thing we can do in midlife because we're still burning calories. We're actually lowering cortisol. We're becoming more insulin sensitive without stressing out our body and without depleting our hormones. So we're not spiking cortisol when we're walking in zone 2. And zone 2 is between 60 and 70% of your max heart rate. So you will take 220 minus your age, multiply that number times 0.6, and then multiply that number times 0.7 to get your high and low range. So for me, I'm 45. So I take 22 minus 45, and then I multiply that times 0.6 to get my low range, and then times 0.7 to get my high range. And so my ideal heart rate while walking in zone 2 is between 108 beats per minute and 124 beats per minute. And honestly, I have to slow down because I'm a fast walker. But again, if you are walking really, really fast and you can't hold a conversation, then you're spiking your stress hormones. And that's not what we want to do in midlife. So less HIIT. Again, muscle is what improves insulin sensitivity, which is what we want in midlife. Also, we need to support our nervous system. If your body is stuck in fight or flight, you will not lose fat. So we want to be getting morning sunlight, 10 minutes every morning, sit outside, meditate, go for a walk your dog, just get outside. It is honestly, it's way better than coffee. Once you start doing it, you will feel so awake, your mood will improve, you will have so much more energy, and then you actually start producing melatonin 12 hours after you are in the sunlight. So let's say you get outside at 8 a.m., then at 8 p.m., you're going to start producing melatonin, and that's going to help you wind down and get ready for sleep. So we want to have a good sleep routine, which I'll do a whole nother podcast about what to do at night prior to sleep to wind down before bed. We want to manage our stress. And typically when I say manage our stress, this does not have to be a pedicure and a massage and a spa day, right? No one has time for that. This can be 5 minutes where you are sitting with your feet up against the wall and you are breathing. And because sitting with your feet up against the wall, like butt up against the wall, feet up, this actually takes our body from the sympathetic state of fight or flight to the parasympathetic state of rest and digest. And it completely just de-stresses your body. Minerals. So again, this is really, really important. If obviously if you didn't do an HTMA test, you don't have a customized multi-mineral supplement from me, but you can really just start with an adrenal cocktail. So this is, some of you can't see me because you're listening to this podcast, but this is what I drink twice a day. It's called Pickleball. I love it so much. And it's high in potassium, which most women need because they're depleted, and it tastes amazing. And your adrenal glands need minerals. Your nervous system needs minerals. I also want to talk about where peptides might fit in, because peptides can be really, really helpful in midlife, because this is where once the foundations are dialed in, peptides are really where you can start accelerating your results. Again, peptides are not a magic fix. You still have to be eating enough protein and getting enough movement and eating in a way that's going to support your body, but they are a powerful tool when used correctly. So here's what peptides can help with. They can help lower inflammation, especially microdosing, improve insulin sensitivity, which we really need in midlife, support fat loss, preserve lean muscle and help you build lean muscle, improve sleep to help you get into that deep restorative sleep, improve recovery. So examples include a GLP plus a GIP microdosing. That's usually where I start my clients. And that's going to help regulate your appetite and blood sugar. MOTS-C is great because it's going to, again, support insulin sensitivity and mitochondrial function. A lot of us have poor mitochondria in midlife, and mitochondria are the powerhouses to our cells. So they're going to help create energy, ATP. And a lot of us have poor mitochondrial function due to aging, inflammation, stress. So that's really where MOTS-C comes in to improve mitochondrial function and our metabolism. Tesamorelin, ipamorelin can be great at supporting body composition, lean muscle mass, reducing visceral fat, so that abdominal fat around our organs. And it also helps with sleep. And then we have specific sleep peptides like DSIP, which can help improve recovery and cortisol. So think of peptides as supporting the systems that are already in place, but that you're struggling with in midlife. So peptides work best when, again, your foundation is in place, but again, they can help accelerate your results. So I hope this was helpful for you guys. I know it was a lot of information. If you feel like your body has changed, and if you feel like nothing you're doing is working anymore, first of all, I want to let you know that you're not alone and that I understand. And I want to let you know that your body is not broken. This is fixable. Your strategy just hasn't evolved with your hormones yet. So we just need a different approach. And when you fix this at the root, we can balance our blood sugar, lower cortisol, reduce inflammation, and support your gut and build muscle. That's when everything starts to shift in midlife. So if you want help with this is exactly what I do inside my coaching program. I help women in midlife get to the root cause of their symptoms with the right functional tests. I help you build a personalized plan with nutrition, training, and advanced tools like peptides. If you're interested in peptides as part of your plan, I guide you through how to do this safely and strategically. You can book a free call using the link in my bio. So theoptimalhealthsolution.com, you can book a free call there, or you can message me the word optimize if you follow me on social media. So my Instagram is amy.bloodsugarqueen. My TikTok is at Amy Hormone Nurse, and my Facebook is Amy Kandetzke, and my last name is Kandetzke. I love you guys. I hope you have an amazing week, and I'll see you on the next one.